There are mainly three different options when a patient loses a tooth. The gold standard is the Cadillac option is dental implant, definitely, assuming that they have the right quality of bone, if they're a good candidate for implants. That's my top recommendation for patients that are losing teeth. See, if you can, if you qualify for an implant and the surgery will be successful for you, you definitely should consider an implant. Placing an implant replaces the root of the tooth um, with a titanium post. Um, and it is designed in such a way that the bone grows around it. So it's supposed to last the lifetime of the patient. Um, and a crown is put on top of the implant. So it looks like a real tooth. It functions like an individual tooth. It isn't as mobile as an individual tooth, but it is a wonderful tooth replacement option. And it's a wonderful tooth replacement option for patients that lose lots of teeth. Some patients get multiple implants and they have dentures that hook down on those implants. So you may have heard some people that have, if you ever spoken to anyone that has dentures, one of their complaints is my lower denture flops all over the place. It doesn't stay put. Well, one workaround to that is placing implants and then having your denture rest on the implants. So it sort of locks in, so it's not so wobbly, and patients that choose to get an implant supported denture are generally happier because it moves less. So yeah, implants can definitely be for one tooth or multiple teeth. Another option for replacing like a single tooth that's lost would be a bridge. A bridge is basically a crown. It's basically three crowns or however many spaces you're trying to replace. But in this case, it would be one space. So it's three crowns glued together. So you have to repair the tooth on either side of the space for a crown, and then they're actually cemented on the teeth on either side of the space. So it looks like three individual teeth, but it's actually one giant crown that's soldered together. But it functions very well since it is cemented on the teeth. It lasts a pretty long time. It can last 20 25 years or so until it starts to break down and you want to consider replacing it. The third option for replacing a tooth like that is not savable is a removable option, like a removable partial denture. It's similar to having a retainer with a fake tooth on it. It's probably the least invasive option. It just involves taking some molds of the teething in the lab, usually makes the prosthesis. Some cases can be a little bit more complicated, but that's the rough idea. And it is removable, so the patient can pop it in and out whenever they want and keep it clean. It's also a lot quicker to make a removable partial denture than like a bridge or definitely an implant. An implant takes probably anywhere from 6 to 8 months total, start to finish, having the implant placed and having the crown made. A bridge will take maybe around a month if you're using an outside lab. And a removable partial denture might take less than a month